And joining me once again on the show is my doctor, Dr. David Klein. I wish he was your doctor because I've never really enjoyed going to a doctor until now. I love going to the stages of life. You don't wait in the outer room all that much time. Oh, you do sometimes when the doctor's sitting out there talking to you. But actually, it is such a great atmosphere. The staff is the best I've ever worked with, and they're treating me for some automobile wreck-related injuries, but we won't go into that. I want to talk today about the fact that when you come here to Central Florida, most of you have been riding a desk for 30 or 40 years. You haven't been exactly out there exerting yourself. And then you move down here to Central Florida, you buy the golf clubs, you buy the boat, you get out there with your paddle ball, and you do your tennis rackets, and then all of a sudden you're joining the gym and you think you're going to just live like you did when you were 15, 16 years old. Well, the body doesn't bend as easily as it did then, and it sure does take some stretching and some building back of 40 years of inactivity. Doctor?
Well, you bet. You know, the last thing anybody needs to hear is a lecture after having a successful 30 or 40-year career. Okay, well, congratulations. You survived the workload. You survived the aggravation. You survived the great north. You know, as much fun as that is shoveling snow while we're down here shoveling sunshine. But the fact of the matter is deconditioning kills people. You know, there's this old adage, you know, that when is a man's time to die? And the answer is shortly after retirement. But much of the reason for this is that you're out there doing physical stress that your brain, which still thinks it's 18, okay, is now being directed to a body that's a little closer to 65 or 70. And what happens is the following. You end up overstretching, you strain, you destroy, avulsion fractures, all kinds of and manners of injuries. Okay, all of which, or most of which in any event, are preventable. Well, what do? Well, the first thing you need to understand, okay, is that as you get older, things start to dry up a little bit. Okay, the tissues in the body tend to become less water-filled. Okay, especially it's true of the spine, the disc, and so on and so forth. So as you start to move around, you find yourself to be far less flexible than you ever were. Mm-hmm. What's more is you'll end up with these little bony spicules called osteophytes around the joints that limit the way you can move. And the last thing that you want to do is to do what your high school football coach told you to do, and that was to push it until the point where you break. No, by the way, your football coach is probably long dead. Okay, here's what you have to understand, is that you have to gradually get into these things. You in fact, have to warm up. Okay, what does this mean? It means that muscle operates better at a temperature of 100 degrees than it does at 97. Take your temperature and see what it is. Okay, it's not hard to do this. You'll be shocked at how low it actually is. What does it take to get your temperature up? Well, sometimes it takes medical intervention because your thyroid may be a mess, but you really do have to get the blood moving, get things going, lubricate it out. So what I typically tell my patients to do, okay, is one, hire one of these little coaches, these little trainers, at least for the first month or two that you're going out, so they can teach you how to properly use the weights, how to properly swing the clubs, how to properly swing the racket, how to properly walk, to fit you with the shoes that you need to be fit with, because you know the ones that you bought 30 years ago, they may not be quite right anymore, okay? And then get out there carefully, get out there concertedly, and get out there more or less gradually, but understand that your brain still thinks you're 18, but everybody else knows differently. Now, what do you do nutritionally? Okay, and this is kind of an interesting question because it does in fact influence your ability to safely exercise. Well, you need to make sure that you have adequate oils on board. These are essential fatty acids. Omega-3 is probably the most well-known of the bunch, but 7s and 9s are also important. 6s you really should avoid. And these lubricate the blood, they lubricate the arteries, the inside of them, but they also lubricate the joints. What else do you need to do? There's something called MSM, which stands for methylsulfonyl-methane, which is a wonderful anti-inflammatory and a wonderful antioxidant that's tremendous when used to treat athletic injuries, but also to keep things lubricated. Do you need glucosamine? It's not a bad thing to have as long as it's the sulfate, not glucosamine hydrochloride, which is absolutely useless. And do you need chondroitin sulfate? And the answer is no. You can't absorb it anyway. Why take it? Now, this is how you preempt. This is how you prevent. This is how you mitigate, modulate, and reduce the likelihood of inflammation within the joints, which will allow you to get out there and play a lot harder. Now, you can use the MSM topically, which I do, most of my patients do. We use a product called Kinkies, which I invented for my daughter's horse. And as I tell my patient, if it goes through horsehide, it go through yowhide, and it does. And it basically lubricates. It's a wonderful anti-inflammatory for shoulders, knees, feet, hands, and so on and so forth. And it's very, very inexpensive. You do this before you exercise, you do afterwards. What else do you need to do? It's nice to get the B vitamins on board, and everybody knows to do this. They're cheap enough, it's easy to do. But without taking care of the oils and the anti-inflammatories, dealing with much else isn't going to make any difference. Now, what's the likelihood of your sport getting you injured? It actually increases. But here, as you age. But here's the fun thing. The fun statistic is that it takes twice as long to heal with every decade of life.
Really?
Oh yeah. So when
when
you're 20 years of age, went there and I broke my ankle and it took 6 whole weeks to heal. 30 years of age, it's going to take twice as long. 40 twice again. 50 twice. Well, guess what? By the time you hit our age, it's going to take you a while to mend properly. And even at that, does it mend 100%? And the answer is no. When I was in general surgery, we were taught that it takes a matter of months, many months, for skin to reach the same test. The strength that it had before the injury. And in fact, it never gets to 100%. It may reach 80% at 2 to 3 years. The tensile strength of the fibers within the wound really are never perfect. And when bone mends, it doesn't mend either. That's why people tend to break the same bones over and over again, and then they end up with twisted and distorted limbs and so on and so forth, which make our orthopedic confreres very happy.
Yeah.
They should be giving away skateboards to the kids. I think they probably do, and rollerblades to their parents.
Well, we just see so many people that come to this area and they try to do everything at once, and they do get injured. And then sometimes they say, well, I'm not going to do anything about it. It's just a pull. It's just a sprain. But can that compound?
Oh, yeah. Well, here's the way that it typically works. Okay, and this is, I get them, typically 6 to 15, 16 weeks downstream from the injury. So you went ahead and you have an avulsion fracture, the 5th metatarsal. Okay, it's a march fracture of a sort. And, how'd you get it? You're out there walking. You didn't give yourself enough time to warm up. Now all of a sudden your right foot hurts. So you start bearing weight on the left side. Well, this throws your weight to the opposite side of your body from the injury, as you would expect that it would. In order for your body to maintain the eyes at horizontal, your hips have to cock upwards, right up, left down. That leads to the right shoulder drop, and this leads to left-sided headache. So a right-sided foot pain will cause left-sided hip pain, which will then cause right-sided shoulder pain and left headache. The longer you allow these things to go, the more I have to treat. And that's exactly the way I look at these things. Okay, what did you hurt first? Left hip, right foot, right knee maybe. Okay, headache on the left side, shoulder problem on the right. In the equestrian world, amongst racehorses and so on and so forth, or even these cute little kids with their polo ponies and cute little kids with their hunter jumpers, they call these diagonals. Talk to the trainers, talk to the vets, because they know how the horses do, but they also know that the horses can't complain. The joke is that you have exactly the same problem as bipeds instead of quadrupeds, so guess what? This is life in the fast lane. Welcome to retirement.
I love the kinkies. I tell you what, after I had my little accident in the car, there was a lot of pain in the neck region. And I could put that on there and I could get some pretty quick relief.
Yeah, your mom liked it also for shingles.
Very much. It really, really helps with the shingles. Hey, in tomorrow's edition of the show, we're going to have Dr. Klein take off on thyroid, because he has had so much success with people that have come to him with every matter of problem that has usually been misdiagnosed out there with the very quick dash and go, doctor's offices these days. But he is an expert when it comes to thyroid, in my opinion. So we'll talk about that tomorrow. It's going to be a great time. Stages of Life Institute is right off I-4 at 434. You can go online to stagesoflife.net. You'll find out everything, and you'll find out all about the nutraceuticals. And doctor, we have 30 seconds to talk about those nutraceuticals.
Well, this is also key to getting yourself into shape, keeping yourself in shape, and preventing these injuries. What we try to do is to make it simple, or as simple as we can, adjust to age, disease state, stages of life, stages of health, oddly enough, and then put this all together for you in a way that makes sense, as affordable as it can be done, at the highest quality. That's pharmaceutical grade, and we do this all for you.
Okay, very good. That's going to wrap up this edition. We're going to have the doctor on tomorrow. We're going to be talking about thyroid. But I thank you for joining us on this segment of the Rob Newton Resource Hour.